Behavioral health training, de-escalation techniques for individuals who have intellectual disabilities and/or mental illness. Why do some individuals become aggressive? It's worth noting that most people with disabilities and/or mental illness are not aggressive. However, individuals with disabilities and/or mental illness do demonstrate aggressive behaviors more frequently than those in the general population. Aggression can serve several purposes for individuals with disabilities. It can be a means of communication, a way to express frustration, expression of illness or pain. It could be an attempt to gain control of a situation. It could be a symptom of psychiatric illness. It could be a way to avoid or escape unwanted demands, or it could be a means of getting staff or family's attention. Some of the potential triggers of aggression include temperature changes, especially excessive heat, noise or overstimulation, staff turnover, hallucinations, psychosis, staff engaging in power struggles with clients, changes in routine, lack of structure, not being able to communicate what is wanted to family or staff, and a perception of being judged and/or disrespected. Some of the physical signs of anger to watch for: fists are clenched, hands are shaking, individual is sweating or stuttering, face is turning pale or red, gritting their teeth or clenching their jaw, or an increase in breathing rate. So how do we manage the anger? The goal is to stop the anger and intervene at the lowest possible level of agitation. One of the best ways to do this is by meeting people's basic needs. In times of crisis and agitation, people typically have a few key needs. They need to feel safe. They need to be able to express their emotions and be heard or understood. They need to know what comes next or what to expect. What not to do. Don't be judgmental or critical of the individual. Don't listen to them. Don't engage in power struggles with the individual. Don't argue with the person, even if you think you're being rational. Don't minimize or ignore the individual's feelings. Don't yell or make demands. Don't talk too much or give unsolicited advice. And don't talk to the person in a childish manner. Effective strategies include the use of our body language. Pay close attention to your own body language. Remember that 80 to 90% of communication is nonverbal. Give the individual some space, typically minimum of about 3 feet, if possible. Don't rush or move too quickly. Be deliberate and smooth in all of your movements. Avoid pointing your finger at the individual. Try to relax your own jaw or body muscles. Avoid giving the stink eye, and never touch someone who's agitated. In regards to the environment, attempt to create a positive or calm environment. Always address the individual by their name. Focus on ways to make the individual feel safe. Encourage him or her to move from risky environments. Avoid side conversations. Limit background noise when possible. Turn off the TV or turn down the music. Take a walk with the individual if they need to move to be in a better place to talk. If possible, learn background information from staff or family, including their likes and dislikes. Make the person feel heard. Ask open-ended questions and truly listen. Focus on validating the individual's feelings. How that person feels right now is the heart of the matter. Paraphrase back what the person is saying to show understanding and create empathy with the individual. Avoid why questions. Asking a person things like, "Why did you do that?" immediately makes the individual feel defensive. Keep your language simple and concrete. Complex questions may increase an individual's stress. Calmly, gently redirect the individual back to the topic at hand if they begin to rant about other topics. Consider carefully distracting the individual or changing the subject if he or she gets stuck on an upsetting topic for too long. Explain any transitions coming or what will happen next. Set clear limits with the individual and give her or him clear choices. Using a collaborative approach is ideal. Remember to be who you are. The best de-escalators remain genuine and true to who they are. Individuals can sense when you are being fake. Once you've set clear expectations or limits with an individual, follow through on them. If you've given your best effort at the above techniques and the individual continues to be dangerous or aggressive, call for help. The video example you're about to watch shows the actions of a medical professional working with an individual with disabilities. The first example is bad practice. The second example is much improved. See differences in both approaches. After you watch the video, please complete the test and return to your supervisor for it to be graded and submitted to staff development by July 31st. Thank you.
Victor, I'm Dr. Lee. Look, I heard you were screaming on the streetcar. What was that all about, man? Victor? Victor? Hello, so I need you to answer some of these questions, the police brought you here, and you basically have to answer some questions, otherwise you can't leave.
I want to leave.
So let's get this clear. You're not allowed to leave until we talk a little bit here, okay? You hear me?
I want to leave.
Victor, settle down, okay? You hear me?
I want to leave, please. I just want to go home.
You need to settle down right now, okay? Otherwise, I'm going to have to call security.
I want to go home.
Victor, settle down.
I want to go home.
Security. Victor, I'm Dr. Lee. What's going on? I heard you were upset. You were shouting on a streetcar or something like that. Want to tell me about that? What was that, Victor?
I want to leave.
Okay, all right. I can see you're a little upset. Okay. All right. Why do you want to leave, Victor? What's the matter?
My head hurts.
All right. Okay. All right. Well, I'm a doctor. Maybe I can help you with the fact that your head's hurting, okay? Now, I know you got very upset before on the streetcar, right? Just, I can see you're trying to stay calm now, But, hey, look, you're doing a good job, okay? I understand you're getting a little upset, you're afraid, but we're going to try and help you, okay? We're here, the hospital, we're here to try and help you, okay? We're going to try and do our best. All right, so why don't you tell me about your head? What's going on there?
It really hurts at the back.
Yeah.
Like right here.
Did you fall? Did anybody hit you?
No, it's just boom, 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 boom. Thing.
Yeah.
I can't really explain it.
Yeah. And is that why you started screaming on the streetcar? Okay.
Yeah, I'm really sorry about that. I really apologize. I'm usually not like that.
That's very nice of you to say that. Okay, it's all right. I'm glad everything worked out okay. Is there anybody with you, Victor? Is anybody I should be calling?
Yes, my sister.
All right. Okay. Great. I'm going to try and get her phone number, Victor, okay?